Okay, good morning. My name is Karen Jane Santilan, and I'm gonna be your PSW, your personal support worker of this shift. So, before we proceed, can I ask you to state your name, please?
I am Ronald Santillan.
Okay, Mr. Ronald Santillan, how would you like to be called?
Ronald.
Okay, Mr. Ronald. Okay, now, again, in verifying your client, there are two ways. First thing is you have to check their wristband identification, and if there's not, you could ask your client directly. To ensure that you are providing the proper procedure to the proper client. Okay, now, next thing to do is you have to explain the procedure to your client, all the things that you have to do with him. So for Mr. Ronel, now that you're in sitting position, I'm gonna transfer you to your chair or into your wheelchair. So after you explain the procedure to your client, um, you have to make sure that your client is using his rubber, which is the non-skid, which prevent him from slipping, and you have to make sure that he is properly dressed or he is properly covered. And then after you ensure that your client is properly dressed and is using the right shoes, you have to make sure that you have collect all the supplies that you're gonna need it. For example, a transfer board or a belt, a transfer belt that you're gonna use. Well, it depends on the agency if they're going to allow that. And then after that, you perform the hand washing. So in doing the hand washing, the only thing that you have to do is you have to follow the right technique of hand washing by saying happy birthday for a couple of times, or doing it by in 20 seconds. So after you perform the hand hygiene, now you have to provide privacy to your client. Now, in providing privacy to your client, you have to make sure that you're drawing the curtains if the patient is in with the other clients. Okay, so um, so in transferring your client to the chair, you have to communicate. You have to communicate with the other healthcare providers, or if there's someone is assisting you, or you have to communicate to your client that you have to instruct them that on the count of three, they're gonna help you. We're gonna swing over him to the chair or to the wheelchair in your cues. Okay, now you have to make sure that before transferring your client to the chair or wheelchair, you have to make sure that the bed is in the lowest position. So this is to prevent from him from falling or from injury. So you have to instruct your client to put his arms or make a fist on the mattress. Okay, sir, can you do this? Okay, you have to make sure that his feet on it's flat. And then when transferring client, if you're using a belt, a transfer belt, you have to make sure it's secured and there's allowance that you can hold on to. This is to prevent the damaging the skin of the client. Now, in doing that, you have to stand in front of your client. Okay, you have to make sure that your feet are 12 inches apart or 30 centimeter apart. You have to bend your knees on the level of the knees of your client. Now you're in that position, you have to grab the belt on the side and you ask your client to lean forward. Mr. Ronel, can you lean forward? Okay. After you lean forward, you have to instruct him that he needs to push on the mattress on the count of 3. Okay, Mr. Ronel, I want you to push brace yourself, and I'm gonna swing you over in the count of three. All right? Okay. On the count of three. Um, 1, 2, and 3. Okay. When you put your client on the chair, you have to make sure that his buttocks is touching on the back of the chair, and uh, make sure that his arm is on the armrest and secured. Okay, once you secured your client, you ask your client, um, Mr. Runel, how are you feeling? Are you okay?
Yes.
Okay. Do you feel dizziness?
No.
Do you feel lightheadedness?
No.
Do you feel something in your eyes?
No.
Okay. If everything is clear, then where the client is, you can proceed now to the next procedure. Now, if your client is in a secure place, is sitting, and he's okay, he's sitting comfortably. Now you have to put the call bell near where he can reach it, and then instruct your client if anything that he needs. He just gonna press the call button, and we gonna assist him in whatever he wants. Now, after that, yeah, you provide comfort, you provide everything. You have to clear the area for any obstacles, put all the materials or the supplies that you have used properly, and do the hand washing, and document um, the the observations that you have observed, and report to your supervisor. Okay, now okay, that is using a belt. Now I'm gonna show it to you how to transfer client without a transfer belt. Okay. Okay. Now in the same procedure, you have to follow the procedure from where your client is. You ask your client to make a fist on the mattress. You have to check everything if it's flat. You're using the non-skid, and then before that, I forgot. You always ask your client before putting on the chair or wheelchair. You have to ask your client if they are dizzy, they feel lightheadedness, they feel like there's something in their eyes. So, Mr. Ronel, do you feel dizzy?
No.
Do you feel something in your eyes?
No.
Do you feel lightheadedness?
No.
Okay. If not, you can proceed to the next procedure. If so, you have to put back to your client to bed, check the vital signs, and then report to your supervisor. Now, transferring client without transfer belt. Okay, you have to position yourself. Okay, 30 feet. Flex your knees. It should be level on the knees of your client. Okay, now put your arms under his arm, and then at the back of his shoulder, and then you have to ask your client to lean forward. Can you lean forward, Mr. Ronel? Okay. After you lean forward, you have to tell your client, Mr. Ronel, on my count to 3, I'm gonna sway you over to your chair or your wheelchair. Okay. All right. All right. On the count, 1, 2, and 3. Okay. You have to make sure also that his buttocks is on the back of the chair, and then you have to make sure that he's holding on the armchair. Okay. Now, once you've done that transfer, you have to put the call bell, you have to secure everything, and then secure the place, clear the place, give everything. If he needs a table, he needs a newspaper, something to read, and everything. After you provide all the necessary things that he wants and he needs, do the hand washing, and then after which, After you do the hand washing, you can now document and report all the observations to your supervisor. All right, and there are some parts that I missed, but I just have to mention it. Before transferring your client, you have to make sure, yeah, it's in the lowest position, and make sure that the wheels of the bed are in place, are locked. Are locked. And if you have also to check that the wheelchair is locked. This is to prevent from the client from injury or slipping. All right. Thank you very much, and that could be all. Yeah. Thank you.